For thousands of years, we've been doing teaching in medicine and in most other fields by having somebody stand in the front of a room and talk at other people. And there's been a lot of research in the last couple of decades that this is not the best way to get people to learn. Whether they are professionals or regular adults or kids, we don't learn the best by just sitting in a chair and having someone talk at us, especially if you just had a big breakfast and the room is dark and it's a good time to doze off. And so the facts that, as I learned, a lot of people who study educational and behavior change have known for quite a while is that if you want to change what someone knows and, more importantly, change what they do, you really need to interact with them, and you can only do that in a one-on-one setting optimally. When I'm giving a lecture to a big auditorium of people, I can't know what they're thinking. Are they believing this? Do they understand what I'm saying? Am I being clear? Do they disagree? I can do that when I'm talking one-on-one with a colleague. And so that really is the model that many other people who've studied education figured out long before we did. And frankly, the drug industry figured out long before we did, and that's why they've been so successful at getting inside doctors' heads and changing what we know and what we think. And so the essence of it is the interactivity is not about my going into somebody's office and saying, sit still for 20 minutes, I'm going to do a lecture at you. It's about saying, Dr. Smith, how do you manage a new patient with diabetes? Or what do you think of when you have a patient with chronic pain? And when you hear what the doctor's beliefs are, or other prescriber, it might be a pharmacist, it might be a nurse, and they explain to you, here's how I approach it, this is what I think is true, this is what I would find hard to do, you can engage in a back and forth conversation, which is the best way to then give them a tailored presentation that will address exactly what their concerns and knowledge are, rather than a canned talk that can't possibly be appropriate for any random person. And that's why we instruct our academic detailers to make sure that they are having a lot of interaction with the doctor and not simply making a speech at them, because you can go to an auditorium and do that, and that doesn't necessarily affect what they are thinking or doing. And so if you can really chat with the doctor as a colleague, then you can understand how best to sort of show them the light, as it were, and get them to change their practice.